This is Reed Paul, editor, federal practitioner. Joining me today is Madhulika Agarwal, Deputy Undersecretary for Health and Policy and Services at the Veterans Health Administration, to discuss telehealth.
Good morning, and thank you for inviting me.
You have been a champion of telehealth, telemedicine, and e-consults and other types of virtual healthcare. Why are these initiatives so important to the VHA?
Our goal is to ensure that veterans have optimal health and that we deliver the best health care with a focus on timely access with exceptional experience. And over the years, VA has been building technological tools so that we can provide the right care at the right time and in the right place. And telehealth affords the veterans that convenience, the convenience of accessing primary or specialized care services either from their local VA community clinic or from the privacy of their own home. We have many virtual access solutions: the home telehealth, clinical video teleconferencing, store and forward technologies, e-consults, My Health eVet, Scan Echo, and these all have demonstrated that they are mission-critical tools which improve and expand the access for veterans who may have difficulty accessing care for multiple reasons. It could be, some clinical issues where there are transportation difficulties, such as for veterans with spinal cord injury or mild traumatic brain injury, or geographic barriers. Many of our veterans, I would say roughly 40 to 45% of them, live in rural and highly rural areas where they may not have access to care nearby. Or it could be further exacerbated, this geographic challenge, by inclement weather or the drive times. And lastly, I would say it's the lack of specialists in these rural communities where many of our veterans live. VHA is successfully integrating into the existing technical, administrative, clinical infrastructures. And this infrastructure provides reliable and robust IT network. We have an electronic health record. We provide national policy guidance regarding health information security, credentialing, privileging, etc. And our strategic goal has been to have personalized, proactive, patient-driven care. And telehealth supports that goal.
Can you talk a little bit more about how telehealth fits into some of the larger and broader VHA goals like the CHOICE program?
So it's interesting that both the CHOICE program, which is part of the Veterans Access, Choice, and Accountability Act of 2014, known as VHA, and telehealth, they both aim at improving veteran access to care. Under the CHOICE program, many veterans now have the option to access community partner health care rather than waiting for a VA appointment or traveling to a VA facility when the geographic distance is more than 40 miles or if the appointment in the VA is not available for 30 days. The CHOICE program and telehealth are two very concrete examples of VHA's transformation from a facility or provider-centric health care delivery model to a model that puts the veterans' needs at the center and improving the veterans' access to resources to meet their healthcare needs. More than 717,000 veterans have accessed VA care through telehealth in FY14, and 45% of these veterans live in rural and highly rural areas. The fiscal year 14, the total for veterans using telehealth represented about an 18% growth from the prior year. And the telehealth services provide access to healthcare in more than 45 different specialty areas, including those areas where VHA has a particular expertise, especially, for example, in mental health, that may not be available from the local community partner.
Do you have any examples of implementation of telehealth that you think are particularly successful at the VA?
The best way to sort of illustrate that would be by examples. So I'm going to cite you a couple of them. So for example, a veteran who's living in a rural area, let's just say in some rural part of Maryland, and has to commute to the Baltimore VA, which is an inner city VA medical center, to keep his appointment for a mental health condition with his VA provider. Now, using telemental health, this veteran can access this provider from his or her own home through encrypted video conferencing and complete the telemental health visit in the comfort of his or her own home so that they are not now subject to the traffic and other challenges that they would otherwise face and get even more stressed than what they started out with. The ability, the convenience of having the service of counseling or cognitive behavioral therapy into their own homes is just remarkable. Another example that I can cite for you would be an appointment in the hearing aid clinic. So a veteran who lives in Florida Keys normally would have to travel for 5 hours from Florida Keys, go to Miami, stay in a hotel overnight so that they can go to their appointment at 8 a.m. Instead, the veteran now can visit the VA's Key West clinic and have his hearing aid adjusted by a VA audiologist who's located in Miami, and it saves the entire trip. So those are two examples of clinical care. The third one I'll just cite to you has to do with the CNP exams. Now, a veteran living even out of the country can access a VA provider using the encrypted video conferencing. They can have the whole clinical evaluation for CNP completed using the video conferencing. So these are some of the examples on how telehealth has been used very successfully.
I think that raises a couple of interesting questions. One is, are the challenges in implementing and expanding these types of programs more technological in nature, an issue of, what kind of platform it goes on, or is it more an issue of provider or veteran education and understanding of the advantages and opportunities in telehealth?
So that's another excellent question. VA has been a pioneer of telehealth. And with that, of course, all those challenges sort of come into play. Now, we certainly have implementation challenges that include provider and patient education and their buy-in into the use of technology in providing services, as well as the technology itself and some administrative issues. They can all be very closely linked. One illustrative example that I just cited earlier about video conferencing is one such example into the veteran's home. It is very convenient. However, we started to implement this home telemental health program a couple of years ago. But since then, about 108,000 veterans have access using the video conferencing technology, but less than 2,000 or so have done it from their own home, largely because the current video visit from home is quite cumbersome. It requires passwords for each visit. It requires the veteran download VA Live software on their own device. And in addition, there are restrictions because of the availability of the broadband internet connectivity, which is required for the video visit, more so in the rural areas. At this time, our General Counsel is reviewing and attempting to resolve state licensure requirements that have been raised by some states because the veterans here receive care at home and outside of our VA brick-and-mortar facility, as well as the legality of VA providers potentially prescribing a controlled substance for a veteran at home without a prior in-person office visit. To overcome the provider challenges, the National Telehealth Training and Resource Center has been working on training the providers in the use of telehealth. Roughly 11,400 VA staff have been trained in the use of telehealth in FY14. We have currently 144 facility telehealth coordinators and more than 1,100 telehealth clinical technicians who assist with training and outreach for both VA staff and veteran patients.
Are there additional legal or security type issues that the VA is looking to overcome as well?
Certainly, high-speed connectivity happens to be one of the key ones. Using 4G services, I think, is going to be essential for every veteran, regardless of rurality. And when these 4G services are not available, that certainly hinders the ability to provide telehealth to all veterans. Having the right security with the full data encryption is essential so that we can protect the private health information of the veteran. But unfortunately, at this time, there is no an easy way to do that. I think a lot of innovation is required so that we can make it much easier for the veterans with one-button access, both for the veterans as well as for the providers. And that's going to require significant effort with technology as well as overcoming certain legal requirements.
Does telehealth drive clinical services and operations, or Is it the opposite, that the clinical needs and operations drive the development of new telehealth programs?
Really, the answer has to be that the real driver here has to be the veterans' needs, neither the needs of telehealth nor the clinical services or operations. I think the whole goal here is that we must use technology to the extent possible. We have to move towards virtual access as the norm. As much as possible, we should provide the virtual access in the veterans' homes or wherever the veterans would like to receive their services. Make the connectivity as simple as possible for the veterans and move beyond the concept of the episodic visit so that the health information and self-care management tools are available to the veterans at all times. And that essentially needs to be the overarching strategy, and that should drive on how we develop the technologies to provide the services.
As the VA looks at these programs, what role do analytics and data analysis play in helping to guide the VA in terms of either its priorities or measuring the success of the programs?
So we have the general enrollee data. We look at access gaps in clinical services and the telehealth activity data for program management and oversight, as well as in developing an overarching strategy for the clinical services and telehealth services. So it's sort of done somewhat in conjunction. And our outcome analysis shows that there has been significant reduction in admissions and bed days of care with the use of telehealth. For example, in FY14, an analysis of 10,621 veterans who were newly enrolled in home telehealth with non-institutional care needs and chronic care management categories had a decrease of about 54% of VA bed days of care. This was about a 32% decrease in VA hospital admissions compared to the same patient data prior to their enrollment in home telehealth. The analysis of telemental health outcomes shows that there was a 35% reduction in acute psychiatric bed days of care for veterans receiving CVT or the clinical video conferencing telemental health in FY14 when it was compared to the utilization in the prior year.
You've mentioned a few programs that you think are particularly indicative of kind of the promise of telehealth, but are there programs that have been developed that you think may have applicability to be expanded further in the VA?
I must admit that there are many more programs that begin in the facilities, but at the national level, the first one is the tele-ICU implementation, where Vision 23 is supporting Vision 15, 5 of the medical centers with clinical video teleconferencing capability for live interactive consults with ICU specialists, and it covers about 78 beds. Vision 10 is supporting Vision 7 in 7 of their medical centers, which covers about 72 beds. Another program, which is in the pilot phase right now, is the tele-wound care pilot, which is being implemented in 6 visions and combines the use of home telehealth, clinical video teleconferencing, store and forward telehealth technologies to create access to a continuum of wound care options across multiple patients and provider settings and locations, all with the goal of enhancing and improving wound care treatment and healing. So this is being developed in different phases. The initial phase has been that all the participating facilities have been identified and some of the operations manuals have been developed. The third quarter of this year, we will have a completion of the operations manual, provider training, and treatment template. The local sites are also working on the infrastructure and knowledge base so that this project can be completed by FY 2015. And the last pilot that I'll mention, which is in its very early stages, has to do with, it's a low acuity, low intensity pilot with the focus on health promotion and health prevention behaviors such as tobacco cessation, weight management, and newly diagnosed but stable veterans with diabetes, high blood pressure, and heart failure using a web-based browser technology.
Does the VA view telehealth as an opportunity to provide an example for the broader U.S. healthcare system?
Overall, when we start to look at the monumental impact of technology on other industries such as banking, shopping, travel, and even personal communications, The emerging technologies continue to change the overall landscape of all these environments. This is an exciting time to be in healthcare industry because I think we have lagged somewhat behind in using technology. But as we look forward, the consumer-driven healthcare is going to become the norm. As you know, we have long been a pioneer with the electronic medical records and with virtual modalities such as telehealth, both in the home and in the community, the use of patient web portals such as My Health eVet, secure messaging, the various apps, kiosks, and we remain on the forefront of developing and utilizing these approaches to enhance healthcare delivery. We all know that healthcare in the U.S. is complex and fragmented. VA is looking to become the benchmark in U.S. healthcare delivery, aiding in the transformation of the delivery of services for veterans and families, focusing on a unified, integrated, and personalized virtual services that seamlessly connect them with the state-of-the-art healthcare system.
Dr. Agarwal, thank you for joining me today.
My pleasure, and thank you.